Every 14 minutes, someone is added to the kidney transplant waiting list. Could you be the hero? Could you just tell us a little bit about organ donation and the work that you do?
Organ donation is a process in which we take out the organ from a donor who can be alive or deceased.
What is the magnitude of patients that really require kidney transplant?
Extent of problem in our own country. We have around 20 lakh patients who are having end-stage renal disease.
So, what do you think are the main hurdles to getting donors for kidney transplant?
Scarce in the mind of the donor and the family. Donor thinks that if I give my kidney, I am not going to live a normal life.
Every 14 minutes, someone is added to the kidney transplant waiting list. Could you be the hero? Hi, I'm Navya Mrig, the founder of Saahas, an organization that aims to raise awareness about organ donation, a topic that is so important yet barely talked about. Kidney transplants are the most frequently occurring transplants in India and are so important. So today, to continue our series of podcasts to raise awareness about organ donation, I'm joined by Dr. Singh, the Senior Director of Urology and Renal Transplant at Max Super Speciality Hospital. Sir is a pioneer in renal transplant and has experience of over 30 years. It's a pleasure being here with you today, Doctor.
Thank you, and thank you for the invitation.
So firstly, could you just tell us a little bit about organ donation and the work that you do?
See, organ donation is a process in which we take out the organ from a donor who can be alive or deceased. That is a brain dead.
Right.
And these organs are taken out and put into a recipient, that is a patient who needs the organ because his original organ, his own organs, are not working well.
Yeah.
And I am into kidney transplant for last more than 11 years now, and we have been performing both live and deceased organ transplant as far as the kidney is concerned. We have got a robust program which is running at Max Super Speciality Hospital now, and which is backed up by a wonderful ICU, radiology, dialysis, the whole of nephrologist team, and the anesthesiologist. So the whole kind of setup is needed for such kind of endeavor.
Right. So, sir, you must be seeing lots of patients in your OPD every day. But what is the magnitude of patients that really require kidney transplant?
See, if we have to discuss the extent of problem in our own country, we have around 20 lakh patients who are having end-stage renal disease.
Right.
And to this are added another 2 lakh patients every year. Unfortunately, these are end-stage renal disease who require renal replacement therapy, and that is not very easily available to them.
Right.
Because of various reasons. The major reason for the dialysis is economy of the country. Now, of the 2 lakh patients every year which are added to the requirement of kidney transplant, only around 13,700 patients get the kidney in the whole year. And of these, there are only 1,800 or so patients who get a brain dead kidney. Rest are all live related programs as per the transplant law of our country. Now, as far as I am concerned, in my OPD, I see something like 60 patients on an average in a month who are on dialysis or who require dialysis. That is, they are the patients with the chronic kidney disease stage 4 or end-stage renal disease. And most of them, they do wish for a transplant. But out of this, around 10 patients undergo transplant because of the limitation of the availability of the donor.
Right.
That is the major roadblock to the transplant program, which is the availability of donor in our country.
So, sir, like you said, both live and deceased donors can donate the kidney. So, what makes a good donor? Like, what are the requirements?
See, the bottom line is, I think I would divide your question into two. The bottom line is, the live donor should be healthy. If I say healthy, healthy means he should not have any comorbid condition.
Okay.
After all, we have to remember that a kidney donor is not a patient. He's a normal human being who is doing this act to save another life of his relative or otherwise for that matter. Now, we have to rule out any such disease which will put such donor to risk. The success of any transplant program all over the world, I would say, is the safety of the donor.
Right.
We have to make sure that the donor lives an excellent life. And if we actually study, because of two reasons: one, that we select healthy patients, rather healthy persons who donate kidney, who come forward, and they are health conscious and they come forward for a good follow-up. That is why survival of a donor is generally more than the survival of general population in any country. So, apart from comorbid condition, needless to say, the donor has to have the healthy kidneys, and both the kidneys have to be functioning almost equal.
Okay.
The reason being, you want to take out a kidney which supports the patient, and you want to leave the kidney which keeps the donor absolutely healthy. So that is very, very important.
Right.
And that is where the whole process starts. And we start with examining the patient, starting from clinical examination to investigations, general investigation, evaluation of heart, evaluation of liver, evaluation of GI system, evaluation of gynecological illness in females, if they are there, is psychological evaluation, that a donor is emotionally stable to take a decision by himself or herself to give a kidney, that he is not under any pressure, he has got no mental illness which will hamper to take a decision as far as the organ donation is concerned.
Okay. And so what do you think are the main hurdles to getting donors for kidney transplant? Why is it that the rates are so low?
A major hurdle, as I mentioned earlier in my talk, are availability of the donor. There are various scares in the mind of the donor and the family.
Right.
Donor thinks that if I give my kidney, I am not going to live the normal life. My lifestyle is going to change. The recipient thinks that why should I take a kidney from my own relative who may become ill? Suppose there is husband and wife as donor and recipient. The wife will come out with a statement, no, he is the breadwinner of the family. If he gives his kidney to me, he won't be able to work. And how will our family run? And vice versa, the husband being recipient thinks that if my wife also becomes ill, what will happen? So there is a scare that if one gives a kidney, he will not live the normal life. Apart from this, there is obviously a scare of the knife. Any person who has to go under the knife is scared, and that also a normal person who is not having any underlying disease. And a very good solution to this problem as far as the donor is concerned has come, that nowadays we perform the donor surgery either by laparoscopy or by robotic assisted laparoscopy.
Okay.
So which is, in common word, is a keyhole surgery. So one has not to cut the abdomen by a large incision, but to enter through the keyhole incisions and dissect the whole kidney and take it out through a small incision, which can be in the lower part of abdomen. Of late, we are doing in females transvaginal retrieval of the donor kidney. So there is no scar. So all these things do matter as far as the acceptance is concerned. Apart from this, there are various beliefs, myths which start coming in our way, uh, as far as the organ donation is concerned. Like, some people believe that if they give one organ in their next life, they'll be born with a single organ,
Yeah.
that is single kidney. So that belief is there, which we need to convince them. Apart from this, as far as I mentioned in the early part of my talk, uh, only say 12 to 13% of the total kidney transplants which are being done in India, they are from the deceased
Yes.
donors. So there is very less awareness, though it has improved in past few years. Still, the there are the family and the patient, the person, they don't give a consent to donate their organs after death.
Yeah.
So many hurdles. Even we face a challenge, even if there is a person who has already given a consent for kidney donation or other organs donation for that matter, the family says no after the brain death of the person. And as per the law, apart from the consent, we have to have
Family.
the consent of the family. And it's a, we also understand as doctors that it's a very, very sensitive issue.
Yes.
Talking to somebody for organ donation when somebody is going to pass away is a very difficult job, and that is where the job of the smart transplant coordinator and the team comes, because the transplant doctors are not involved in that process. So some intelligent person has to be very empathetic towards the family, explain them that the cause of this and the effort which is involved, in which they are the part to save so many lives in a single effort.
So like
Apart from this, I would say there is another limiting factor, which is economy.
Okay.
But just to further explain it, if we see the cost of a transplant, for that matter, the cost of the transplant is equal to 2 years of dialysis treatment. On an average, in public sector in which I am practicing, a transplant costs around 6 to 8 lakh rupees.
Okay.
And this much is the cost of the dialysis, various tests, various investigations, and admissions of the end stage kidney disease patient who are on dialysis.
Right.
So if you analyze overall, the transplant is much more economical than the dialysis itself.
Yes. So, like you said, there are lots of misconceptions and myths in society surrounding organ donation and kidney transplant. So, how do you think we can overcome these misconceptions to increase the rates of organ donation?
See, there are lots of myths and misconceptions. One of them I talked about is the religious belief
Right.
of not donating. The second one is, some donors think that I'm too old to donate. I've already crossed 50 years or 60 years of my life, which is not true.
Yes.
As far as the deceased or brain dead donor is concerned, we can take out the kidneys of 70 years, 80 years. Some people think that if I give a consent to donate my kidney or the other organs, then and I become ill, I'll not be taken care of. Now, we need to explain that a doctor who is treating the illness is not at all involved in the deceased donor or brain dead donor transplant program.
Yes.
For example, a medical ICU doctor under whom the brain dead patient is there, he is not involved in the transplant program. So his job is to treat the patient. Now, similarly, people think that if they have filled up a donor card, so the kidney can be forcefully taken out from their body. It is not so. They can always change their mind as and when they want to retract back. It is, after all, their own choice to, to give the consent and have a donor card and say no. Once they get the donor card, they have to tell their relatives,
Exactly.
needless to say. Then there is a scare that with the family as well as person who gives the consent for the brain dead donor transplant, that the body will be mutilated, which probably we need to make them aware that the operation of retrieving the organ is a surgical process
Yes.
in which a meticulous dissection is done and body is handed over in a good condition to the family. Apart from this, there is a scare that the funeral process, for example, will be delayed. Yes, it gets delayed because if a patient has to undergo a process of donation of organs, but there we need to explain the family that it is being done for a very good cause,
Yes.
and this donation is not going to save one life but many lives. Then there is a thought process in people that, okay, what is so good? I am giving my organ, I am going to save one life. So we need to explain them that each brain dead donor can save many lives.
Up to 9 lives.
Yes, and maybe more sometimes.
Mm-hmm.
2 kidneys, 2 lungs, heart,
Right.
pancreas, skin, bones. So, and I will multiply this number with 5 or 4 or 3.
Mm-hmm.
That is, they are giving saving a life and saving the life of the, or changing the life of the whole family
Yeah.
who are attached to that particular patient. So that is why we need to create an awareness, which I am very happy Saahas is doing.
Mm-hmm.
That you are creating an awareness for everyone. We need to create an awareness, and if you ask my opinion, it should be an automatic consent.
Yes.
That, for example, you are getting your driving license made. It should be an automatic consent that, okay, if I am brain dead, my kidneys can or other organs can be taken out. And if you don't give consent, it means the organs can be taken out. But if you want to say no, then you have an option to say no. Apart from this, sometimes the patient gets scared that they will not get attention because of the disease I explained you earlier also,
Mm-hmm.
which we actually need to sit down and give public lectures and tell them no, it is not so. They are the people who give consent for organ donation. They are very, very special strata of our community.
Yeah. You're absolutely right, sir. So, lastly, what message would you like to give to the viewers today?
The message is, one, don't be scared. The transplant is changing. In earlier days, there used to be many roadblocks, like the expertise of the surgeon, availability of the good transplant centers, availability of the good equipment,
Mm-hmm.
open surgery for the donor. Things have changed.
Yes.
Apart from this, the transplant medicines have changed. The rate of rejection has really gone down. With the new medicines and the new methods like plasmapheresis, prompt ABO incompatible transplants, that is when the blood groups are not matching,
Mm-hmm.
and recent technique, the success of transplant is quite high now. We need to tell them that the transplant is going to change the quality of life
Yes.
in terms of the time saved, in terms of their productivity, in terms of their activity. You just now had an interview with one of the recipient
Yes.
who is, I heard, is a football player.
Yeah.
Yeah.
He treks.
So and he is able to eat whatever he wants to. They become sexually active. They can procure. They can have their family, and they save so much time to earn.
Mm-hmm.
So the whole thing changes. So if I have to put the dialysis versus transplant on the scale of 0 to 10, if 10 being a normal healthy individual, I would put a transplant patient at 7 or 8 and put dialysis somewhere at 3 or 4. So we need to tell. We need to remove the scare as far as the brain dead donor kidney transplant is concerned. I think I've told enough. We need to create a public awareness program in which we need to convince people and tell them that I think this is one thing which we are doing, and we are not losing anything in the process. So my message is, donate your organs, and you will be live even after that.
Yes. You're absolutely right, sir. Thank you so much for being here today and giving your insights. It was a pleasure having you.
Thank you for the invitation.
If you want to know more about organ donation and want to pledge to be an organ donor, log on to organindia.org to know more.